I choose my topics for the Hair Transplant Roadshow typically from questions I received from patients the previous week. And this past week, a patient asked, as many do, if strip surgery was obsolete. A hair transplant involves harvesting hair follicles from an area with lots of hair, usually the posterior scalp, and moving them to a balding area, generally elsewhere on the scalp. Two methods of harvesting exist, the strip method and FUE, or follicular unit excision. Each has advantages and disadvantages, but for some reason many people think only one procedure should exist, which makes no sense. The majority of photos today are taken with smartphones, which are newer than older cameras. Does that make SLR cameras old-fashioned? The majority of books purchased are digital, which are newer than hardcover. Does that make hardcover books old-fashioned? The answer is, of course not. Sometimes one is better than its alternative, and the same is true for hair transplantation method. To help me discuss this topic further, and with a great accent, I've invited one of Italy's premier hair surgeons, Dr. Vincenzo Gambino. Hi, I'm Dr. Robert Haber, hair loss expert and hair transplant surgeon from Cleveland, Ohio. Join me and the Hair Transplant Roadshow as I travel the globe seeking answers to important surgical and non-surgical hair loss questions from the true experts in the field. So today, the Hair Transplant Roadshow travels to one of my favorite places in the world, Italy, and specifically to Milan, where my guest is Dr. Vincenzo Gambino. Now, I'd like you to please support this program by selecting like, subscribe, and requesting notifications when our next episode is available, and feel free to post comments and topic suggestions as well. Dr. Gambino has been a highly respected member of Italy's hair transplant community since 1999. He's a fellow member of the ISHRS and served the International Society of Hair Restoration Surgery as president and on its board of governors. He's also served as president of the Italian Society of Trichology and the Italian Society of Hair Restoration. He's the head of baldness surgery at the Cosmetic Dermatology Unit of the San Raffaele Hospital in Milan, and I've had the pleasure of operating right alongside Enzo, and I can say that his technical and artistic skills are unmatched. He approaches every patient as if they were family, and I would not hesitate for a moment to allow him to operate on me. And so it is a great honor and privilege to have Dr. Gambino on the show to discuss the topic of, is strip surgery old-fashioned? Ciao, Enzo.
Hi, Bob, and thank you really for your kind words. Really, thank you. Grazie, my friend.
Well, it's a pleasure having you. Enzo, tell our audience a little about your practice in Milan.
Okay, I started my practice in Milan basically in September 96. And at that time, really almost no one was performing hair restoration surgery. So I went all over this symposium. Some dermatologist was looking at me, what is he talking about? I was invited also from hair professional, haircut professional. And I remember I did everything from scratch. I arrived in September and I performed my first surgery December 23, the day before I went back home to New York, where my family was living. And at that time, I was the only one, meaning I didn't have any assistants. I had just the surgery room and the patient. And I did everything by myself. Of course, it was a different kind of surgery in terms of number. We used the dilators, if you remember, and I did everything. I called him the day after from New York. He was fine. And then little by little started. And here I am after 22 years.
Nice. And we had younger necks and hands back then, too.
Absolutely. If I look at my pictures then at the symposium, wow, it's me. Was me, yes.
You know, the history of hair transplantation starts with big round plugs and then smaller grafts, then strip harvesting, which of course was part of the era that saw the greatest advancements in hair transplant results. Then came the FUE technique, which struggled for several years in terms of quality, but now produces excellent results as well. But there's a misconception shared by many people that only one technique is best for everyone, and that strip surgery is now outdated and old-fashioned. And so what do you think about that belief?
Bob, I totally I agree with you. There is a saying in English, one fits all, but not in this case. One doesn't fit all. I really believe that FUT is good, valid, excellent surgical technique for hair restoration. And I'll tell you why, then we go one by one, Bob. Four things come to me. First of all, the certainty of the safe donor area. Second, almost transaction-free harvesting for better grafts and higher quality rate. FUT leaves, as you know, a very fine linear scar, and we can talk about that. And least but not the last, I think is really the most important, FUT is performed by only doctors, not technicians. And here, as you understand, I can open a wide door for what we can talk in this interview, Bob.
Yeah, and every one of those things is critical. And you know, the safe donor zone alone, right there, we can do 4, 5, 6,000 grafts over a period of time, and 100% of those grafts come from this traditional safe zone that we can be very comfortable. That people aren't going to lose those hairs. Whereas the same number of grafts with the FUE technique, we have to go above and below, and that's okay as long as the patient understands the inherent risks with that. And then, yes, the black market is 100% FUE. So the only way to absolutely guarantee you're not in a black market practice is if it's an office that's performing strip surgery.
And in fact, Bob, I believe, as I said, that we, as hair restoration surgery, should be able to perform both techniques and choose the surgery that best solves the patient's problems. Because if you have only one, you may reduce the patient option for excellent results. And I go one step ahead. I think every single patient is a good candidate for FUT, but not every one patient is good for hair transplantation. So, and most of the young people entering, they're doing only that. And you know, and you said it before, it's not that someone said, oh, you will be like a dinosaur. No, because when you and I started, as you said, we started with the FUE. FUE with the larger diameter punches. Now we use a smaller one. So you should be able, how can you treat a class 6, 6.5, that has only 2 centimeters of donor area with FUE alone? My belief is, and this is what I offer my patients, is both technique together can solve the problem best for the patient. I think some misconceptions were bed scars with FUT. And as you know, any surgical procedures leaves scars. Either good scars, bad scars, depends on the patient, the surgeon hands. And I think this misconception, because at that time there was only FUT, and we used to do 3, sometimes even more. What I do now, Bob, is the most FUT are 2 surgeries. And you know, we have a trichophytic surgery that almost leaves no scar. After the second surgery, if the patient still needs something, then I propose FUE to take the grafts above and lower the fine line and transplant the fine line scars for FUT. Again, with the second surgery, we remove the previous scar. So there is only one line. Unfortunately, with FUT, you add the scars to scars. So that is my belief, Bob, and I have to tell you, the results are excellent. And if the patient is well educated, if you as a doctor explain the patient both, most of the time they say, Doc, I didn't know this because of the internet where everyone has his own interest. So who will listen this one? I would like to tell the potential patient, ask, are you a doctor? Yes, if you go to him. Are you performing the surgery to me? Ask any question, what's the best to you? That's the best for the patients because we are ethical doctors.
Agreed. I can't think of any specialty in medicine or any field whatever where they use one single tool, right? We all have multiple tools. I don't care whether you're a musician or a carpenter or a surgeon or whatever. We have multiple tools, and the harvest method is really just one of our tools.
Abs-
FUE is a tool, strip is a tool. We need to have more than one tool, and I couldn't agree more that of the potential downsides of if we talk about over harvesting or remember FUE leaves scars, just thousands of small scars, but
exactly.
it's still a scarring process. And yes, if you go back to the 90s and maybe around that period of time, there was some really bad strip scars that were left in the back of the head. We used to do stacked scars, remember, and
Yes,
that didn't look good.
the,
So
the
unfortunately, a photograph of that on the internet sways a lot of people
I
thinking,
know.
oh, well, that's what it looks like. Well, that's not what it looks like anymore. Our scarring is so much better than it was before. Usually just a pencil thin scar back there and well hidden within that safe donor zone. Just nobody shows off their great scars on the internet. Why would they do that? They just show off bad scars on the internet.
I
And,
totally agree
and
with
that's
you,
fine.
Bob. And if you remember, our good friend Russell from Australia used to define the Venetian blinds, one on top of another. But then there was the evolution. So we started to implement the previous scar. Now we do two kinds of suturing, internal and external, trichophytic, and then I think again the cherry is to transplant with FUE is a fine line. And the worst that FUE brought to the patient is this black market hairball, because there was no black market. No one but doctors used to harvest the donor area, unfortunately.
I think you alluded a few minutes ago that the patient should ask questions. Ask questions, and the most important question is, Doctor, what part of the procedure do you personally do? And what part of the procedure do you delegate? And if you delegate, what are you delegating and who are you delegating to? And if they're not crystal clear about what they're delegating to, then that's a warning sign. Anything that's cutting the skin is surgery. Maybe
I,
a tiny little piece, but it's surgery. And the doctor should do 100% of that, him or herself. The only thing that can be delegated are non-surgical steps.
Absolutely right, Bob. And in fact, as you know, the ISCRS, that is the largest, the most famous hair restoration medical society, requires who wants to become member that right subscribe that he performs all the medical surgery as it should be. I have the staff, but I do like you do, like our old colleagues do all the surgical part. I do the anesthesia, I do the harvesting, I do the suturing as a FUT, and of course I make the incisions. And my staff, what does? Only they prepare under microscope the grafts and they just place them in. As FUE, I do like you do the anesthesia, and one by one I make the incision in harvesting. And in fact, FUE doesn't stay any longer as at the beginning follicular unit extraction, but stands for follicular unit excision that implements a surgical, uh, a surgical part of the procedure. And not like everyone else in the black market happens, they throw them in a little room and you see these people, I don't know if they are nurse, if they are technician, like a machine, boom, 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 boom. I mean, I make 5,000 holes. If I remove only 3,000, who cares? And the doctor is not even there. How can people, patients, can choose this kind of? And you know, the worst right now is in Turkey. And you know, like I know, we have excellent hair restoration surgeons in Turkey that are
Yes,
friends, are colleagues, part of SHRS.
but they're not cheap. People go to Turkey for a $500 hair
I know,
transplant, but
I
they're
know.
they're not going to. They're great surgeons in Turkey, but they don't charge $500. They charge real money because they're real surgeons and their quality is extraordinary.
Absolutely,
But if
Bob.
you're looking for a bargain, you're going to be unhappy with that. And unfortunately, the black market exists right here in the United States as well. Here in Ohio, there are many primarily plastic surgeons who buy a machine and then delegate everything to an assistant. A follicular unit is a full thickness skin graft. The fact that it's small, but it has epidermis, dermis, subcutaneous tissue, intact, skin structures. It's a full thickness skin graft, which is a surgical procedure. Maybe tiny, maybe lots of them, but it should not be delegated. And the strip procedure, as you said before, is never done. There's no black market in the
No,
strip procedure world. So if your doctor does both, again, you're more likely to be in the hands of someone who's not a black market practitioner
exactly.
or doesn't inappropriately delegate.
And again, it's very, very important that the patients ask questions. Doc, you sure FUE is the best for me? There are other options, and we explain to the patient what is the best for him. And we tell, on my opinion, is this. If you have any question, I can answer to you, and I'll be performing your surgery, regardless the technique that you choose or we choose.
Another advantage of being able to perform both is the maximum life supply of grafts. Now, Ron Shapiro and David Josephitis showed this very beautifully, that the maximum lifetime supply of grafts will come from beginning the hair transplant journey with strip procedures and ending the journey with FUE. And some people will need to maximize their grafts. Not everybody will, but for those that will, that's the best way to go. So if you can have an FUT or a strip procedure, that's a great way to start. We're going to harvest 100% of those grafts from that safe donor zone, leave a beautiful linear scar. You don't have to shave. We can do very large sessions very quickly with microscopically dissected grafts that, as you said, have no transection because it's all done with direct visualization. And then we can do the FUE procedure a little later if we need to get a few additional thousand grafts.
Bob, I know that Ron did this study, but as I told you, this is my approach to hair restoration. Really, leaving always something in the bank as as I say, for later on. And you know, in years to come, Bob, not for again good doctors that perform the surgeries, but for the ones that technicians are performing, you'll see in years to come how many disasters. FUE grafts harvested from no donor area, then you'll see the scar there and the hair that falls out. And unfortunately, I have already seen in Italy patients that they have come to me and tell me that we were happy with the result for 2 3 years. And then the hair became a little thinner. I would like the other procedure. I have to do a surgery, Bob. This is really wonderful. A patient who had first FUE in the front, like 4A, and then from the back, the FUT. He came to me, he booked the surgery, and he wants me to do FUT in the front because the hair is almost gone. So I'll take pictures from the FUE and FUT, and you'll see like the FUT is very healthy and still there. Personally, I have a patient that I operated 30 years ago. The hair is white, is there, and these patients bring me their sons. And you know what? They tell me, they ask me, and I feel really, I'm getting old. Doc, you're not going to retire. And I said to my wife, will never make me retire. But being on the serious side, it's very, very important that we choose the best for the patient and are both together. This is what we doctor, we should talk about, both techniques together.
Agreed. I have people that come in for their consultation and they're shaved completely bald. I'm assuming, okay, this is an FUE procedure, no question about it. And then after a discussion of both techniques, they say, you know what, I'm only shaving it because I'm balding. I'm going to grow my hair out and have a strip procedure. And shocks me when they do that because
Yes.
they would have rocked that shaved look well. But that happens on a regular basis. We offer both. And if you can offer both, you can offer what's best for that patient. And when the patient understands the potential downsides of each procedure, and both procedures have downsides and upsides, if you only present one technique, that's not fair for the patient.
And you
So
know,
I think,
Bob, what has been always one of the best things about hair transplantation performed by a surgeon, doctor, hair restoration, is I say the hair will grow. Let's start from there. What will make a difference is the way it grows, the quality. No one should say you had the good transplantation surgery. And in fact, this is what they say. They say, you look better. What, did you shave your beard? But
right.
they don't understand. And unfortunately, I see in Italy, I don't know you in America, they do the hairline that is the most important thing, all the same. I define them, again, not, please forgive me, I don't refer to the good Turkish doctor that we know, but to the black market, they do Turkish hairline. Widow peak like here, they do the temporal reception like you were 12, 14, and they will become later on class 6. Can you imagine the way you are going to look? Terrible.
So there, it's all technical and no artistry.
Yes,
And hair transplantation is a combination of technical skill and artistry, and one without the other is useless.
exactly.
If you can harvest beautiful grafts, but you have no idea how to create a hairline, you haven't done anything good. And if you have a great artistry, but you can't get the grafts out, that's no good either. So you have to master the technical aspects for sure. And some places that's all they do. They're so proud about getting out the grafts, but they don't know what to do with them. They can't
Exactly.
they can't create a natural looking hairline. It's very
Exactly.
frustrating.
To make a
And then
decision.
you and I and then we have to fix that. And it's so difficult to fix a bad
Yes,
hairline. It's so much easier to create it from the beginning, but fixing it takes twice as much time as it
Bob,
would to create the beautiful one to begin with.
Bob, I received, and that can really shock with people who doesn't believe, an email 2 days ago. The gentleman I have not met asked me, Dr. Gambino, and again, nothing against FUE. I love the FUE. Please, I don't want to be misunderstood. Please. And there is this email that I can show to all of you once that want. He said, I underwent the FUE procedure. Now I see myself, I don't like what is growing. Could you please remove the grafts that were placed in the bald area and transplant on the donor area? You understand?
Wow. Yes. Yeah. No, I get that too sometimes.
So
And it's
this is the
it's
first time someone tells me that, asks
yeah.
me for. So
Take them out and put them back.
yes,
Right.
I really think we are lucky. We love what we do. We are in a beautiful, beautiful field. We love. I'm in my office 7 o'clock. The first patient gets here 7:45 before my staff. When the patient walks in, he smiles. We do the surgery. He goes home, and later on, after 6, 8 months, he comes back with his smile on his face. So we are very lucky, and we should really educate the people. We should know this black hair market to overcome what we have worked for the patients, because everyone works. Like me, we refuse patients when we say is it too early or don't do it, the surgery is not good for your area. So it's not for money, because the black market, believe me, doesn't do it. You and I do it. So we have to do for our patients.
Yeah, and it's very frustrating for those of us that do love what we do and that have worked so hard for, a quarter century to elevate the reputation and art and science of hair, to have people come into the field that are just doing it to make a quick buck and are sacrificing hairs and patients' appearance and cosmesis just for that dollar. It's very frustrating. And we are unfortunately relatively powerless to change it, other than just saying, look, we offer something better. But the patient has to take the time to research, has to understand the differences, has to not believe everything they hear on the internet, particularly strip surgery is old-fashioned. It's not. It's alive and
No,
well and wonderful. Side-by-side FUE as both beautiful techniques. I perform both of them on a regular basis, and I can offer those to my patients depending on what's best for the patient.
very good. I hope patient who sees and watch this video really can help them. That, to me, talking to you today was for me to try to educate, because what I said, you knew it, and all the good doctors knew it. So I hope it's for the patient that can be educated better.
That's my hope. That's my hope. Thank you, Enzo.
Please, was my pleasure. In Milan is gorgeous day. I skipped my lunch to be here. I will have a good dinner, but Bob, I thank you, and I thank all the people that will watch this video, and hopefully it was useful for them. Grazie,
Very
Bob.
useful. And to have an Italian skip their lunch is not a good thing. So I appreciate how important that is. Hopefully you've helped dispel the myth that only one procedure, should exist. In Europe, even more than the United States, FUE is the dominant technique. So I think it's important for people to know that a prominent European surgeon like Vincenzo Gambino is still very supportive of the strip method of harvest. Enzo, please tell our viewers how to get in contact with your office to explore surgical options with you.
I mean, listen, I have only my website, vincenzogambino.com, and in Milan I work either at San Raffaele Hospital or Centro Medico Turati. I don't do any advertisement. Our advertisement are our patient, as you know.
I do know that. That information will appear on the screen as well. Again, I can't say enough about how wonderful Dr. Gambino is in not just the surgical part of the procedure, but the non-surgical part. I hope our viewers find this episode educational. Again, don't forget to subscribe. We'll see you next time on the Hair Transplant Roadshow. Thank
I
you.
will. Bye bye.